Well, hello everyone. My name is Steve Long, and I'm running for Congress in Texas's 8th Congressional District. I hope you viewed my introduction video, but if not, here's just a little quick rundown on me. I grew up in East Central Texas. I graduated from Sam Houston State University with a degree in business administration. I have 4 kids and 2 grandchildren, and I'm running for Congress because I think I have an adequate amount of real-world experience that would help in acting in the best interest of the typical hardworking citizen of the District 8 area. I have conservative values, specifically wanting to advocate for balance in the budget, which goes hand in hand with healthcare. I'll show some data here, and I'll be posting this on social media. I hope to get your comments, what you think about it. And obviously, the healthcare goes hand in hand with the national budget and the deficit. So let's get started. And so here you have a national debt trend, and you can see just for this discussion, I just wanted to point out the COVID era, and you can see how the national debt rate has been to increase since that point, and a big portion of that is medical care, uh, partly because a lot of the larger portion of the general population has gotten on Medicaid, and then you have the demographic trend of the older population, the baby boomers, getting on Medicare, and the medical expenses related to that. Nothing against uh, anyone as far as that goes. As far as healthcare goes, many of these people have paid into the system for years, and we should take care of the people who have done that. So here you can see the different segments of the overall budget, and Medicare, Medicaid, obviously take up 24% of the budget. My platform for running for Congress is to be an advocate for balancing the budget, reducing the deficit, reducing the national debt. So obviously medical care is a big factor in that overall decision. So that's what we'll be discussing throughout this presentation. So here you have a plot of the healthcare spending trends in the United States from 2000 to 2023. A lot of this data was pulled from 2023 data, which is, I understand, not the most current, but at least it shows the general trends. Here you can see the total healthcare spending in the United States. 2023 was about 4.9 trillion is the official number. The green line is private spending, which is a little over 2.5 trillion 2023, and then government a little over 2 trillion during 2023. And you can see the trend obviously is going up in the healthcare expense. So here you have the spending trend with different age groups, and I'll talk more about this on some other slides in more detail, but for now you can see just the general trend of the older population. This is from 45 to 64. The red is 65 to 84, and you can see how the expense increases, and that is expected to increase uh, beyond to 2050. And here's the orange, which is the 19 to 44 group. Again, still going to increase, but anyway, just want to point out that this is not something that's going to end anytime soon. There will come a point where the population, as we'll see later, begins to plane out uh, according to projections. But the healthcare, as the population gets older, more people get older, you're going to have more expense in healthcare. Here you just have a breakdown of the private versus the public spend percentage on healthcare in 2023. The official number was 4.9 trillion, and you can see here government made up 45% of that. It's basically Medicare, Medicaid, CHIP, TRICARE. You have the federal part of the spend, and then you have some states also contribute to on the state local level, and then of course the private. That's 55% of the total healthcare spend, and that's private insurance. And you have also direct pay, out-of-pocket pay, so 25% of the total. Yeah, so this is just a pie chart showing the distribution of spend based on the last slide we talked about. If you like colors and pictures, you can see the red is private, and then the blue here is the Medicare, the orange being the Medicaid, and then the other as well. So here you just have the breakdown of Medicare and Medicaid and the percent that each one takes up for the medical spend in the United States. You can see according to this, it's a little over $1 trillion for Medicare, around almost $900 billion for Medicaid. And so here we have a slide that obviously shows what we already know, is that the older a person gets, the higher the expense from a medical standpoint. And nothing against our elderly. Obviously, we need to take care of them. They've paid into the system for years, and it's their turn to live their golden years. But you can see here, 65 to 84, around 21,500, 85 and older, around 32,500. Now, I got different numbers on this data set right here on the different reports, but the trend was the same. And which, this all points out what everybody knows: the older you get, your bodies start to break down, and therefore you have higher medical costs. So here we have data showing the age groups and the population growth of that age group. I'll just start out the older group, 65 to 84. This will actually be the age group that I'm in. I'm 58 right now in 2026, so it's not too far off. So I'll be in this trend of people, and this is the 85 and plus. You can see that population is expected to increase as well. So just more emphasis on we need to get a handle on our medical care expenses as it relates to elderly people. I'll be in that group, and you can see the younger age groups, the population is expected to decrease, and that's due to the lower birth rates among younger couples these days. People are just not having as many children, and which is part of a demographic trend. Yeah, so I just want to throw this slide in as an interesting data point. You can see this is a population projection for history from 1900 and then projected all the way to 2075. Here we are at 2026. You can see that the population in the United States is actually expected to level out at somewhere around 350 million. And obviously that reason is because the birth rate is starting to decrease among younger couples. So you have a no growth of the population, or less growth of the population. So here you have the breakdown of the different categories of healthcare types cost, and you can see at the top of the list, hospital care 30%, and physicians, clinical services 22%. This long-term care is nursing home facilities, in-home care for the elderly, prescription drugs 12%, and so on. So here we have the cost per ailment. This is total government cost. Obviously at the top of the list is coronary heart disease. Then we have hip, knee replacement, surgery, then complications with diabetes care, insulin complications, kidney, neuropathy, cancer, mental health, respiratory, neurological, etc. Yeah, continuing on with they call the mid-tier cost conditions on the ailment. You can see here kidney disease, injuries, trauma, digestive system, infectious diseases, maternal, neonatal, which is relatively low on the scale. And then finally you get to the lower cost ailments, eye disorders, skin, dental, hearing, preventative care, and screening. Yeah, and so this is an interesting plot. The blue is the life expectancy, and you read that on the right ordinate. Okay, so this shows about 79, 80 age, and here in the orange is the per person spend, and so you can see, this isn't corrected for inflation. I'll show you the next plot in a minute. Will be corrected for inflation, but in real dollars, this is the cost per person and total spend for healthcare. This is 2023. So as we talked about, about 4.9 trillion. This is total spend, not government spend, but total. And it is interesting. Yes, the life expectancy kept increasing from the 1960s, from about 70 to roughly 80. So 10 years of increase of life expectancy. You can see it's kind of leveled off. Here's the COVID era. And so anyway, interesting data point. Here's the same plot we saw earlier, except this is corrected for the cost per person, and the total healthcare cost is corrected for inflation. And you can see that again, life expectancy increased as we spent more, but it kind of puts it in perspective. We're spending more, but not as much as the previous plot indicated. When you correct for inflation, the amount of money we're spending total and per person for healthcare. Here we have a age distribution and cost of the typical heart surgeries. You can see, obviously, as you get older, more likely you're going to have some sort of heart surgery. And we all know someone who's had to have heart bypass surgery, etc. But here's the different age groups and the cost. You can see how that is a major contributor to the healthcare system. And it's very common among the aged population and even in some younger groups as well. So here you have a slide showing the age group and share of knee replacements within that age group, and then the cost. You can see one knee, $50,000. Both knees, 60 to 100. If you get them done at the same time, you can get them done for 45 to 80,000. So common among the aged for obvious reasons. Let's talk about the Affordable Care Act. This has been in the news a lot lately. Basically, this is known as Obamacare. It was passed in 2010 to provide insurance for individuals who didn't have employer-based insurance. They could get the insurance based on a reduced rate based on their income, and the government subsidized the remainder. It outlawed pre-existing conditions, provide free preventative care, other essential health benefits, and it also expanded Medicaid to other low-income adults. Currently, there's about 40 million people covered under the Affordable Care Act. When you look at the cost of the Affordable Care Act relative to other government-related expenses, you can see here it's 111 billion in 2023 compared to 584 on Medicaid and 839 on Medicare. I was kind of surprised by this after researching it, but it is what it is. That's the number. I was surprised how low it was, actually, to be honest with you. And we've all heard in the news recently this political disagreement between the Democrat Party and the Republican Party on the ACA subsidies. And what this amounts to is there's a group of people, the number is 1.6 million out of the 40 million people who are currently signed up on ACA, were allowed to qualified for subsidies during the COVID era because that was a period when a lot of people had reduced incomes. So the government decided to, or the Biden administration decided to increase the extension level to higher income individuals. Well, that cost is about 350 billion over a 10-year period, which would add to the deficit. And so the Republicans argue we should let those expire. These are higher income people, and the common taxpayer shouldn't be subsidizing these people of these higher incomes. And the effect of obviously is that would lower the deficit. The Republicans have also issued another plan that would reduce the cost and reduce the deficit based on market reforms, employer-focused changes, and no ACA subsidy extensions. And that's the gist of the disagreement on ACA subsidies. Here we have a table showing the different income levels and the annual difference in before and after the subsidies. And this is based on the one. Remember, this is only affects 1.6 million out of the 40 million people that are currently on the ACA plan, and based on a family of four, two adults, two children. So here you are, obviously at 25,000, you're on Medicaid. You're no difference. 40,000, 2160 difference, and going down to the different income levels. Probably the most affected would be a family of four making an income of 130,000 a year. Their insurance is going to go up $10,000 a year, and that's a bad deal for them, obviously. Whereas they were getting it before for 5,000 a year. But I guess you have to ask yourself, if you're a taxpayer and you're out there paying in the system and paying your taxes and probably with about the same amount of discretionary income as this family, are you wanting to pay for their medical insurance when you're probably barely making it yourself with the you know family of four on $130,000 a year wherever you live? So that's the crux of the matter and the political divide we have. The people who are the common middle class taxpayer that's paying in and is strapped, and then there's the people who on the other end of the scale who want their insurance subsidized. So there you have the political divide we have today between the two groups. Okay, so let's talk about the insurance companies. It's often claimed in the political world by politicians that the insurance companies are to blame for the high cost, etc. Here's a tweet from Trump in Trump fashion, calling the insurance companies big, fat, rich insurance companies who made trillions and ripped off America. So let's look at that. Insurance companies operate under what's called a medical loss ratio, and that are insuring people on the ACA plan. And what this means is, depending on the type of plan that they're insuring someone through, either an individual or small group plans or large group entities, they have what's called a medical loss ratio of 80 to 85%. So, for example, for every $100 in premiums collected, 80 to $85 has to go to be paid out to medical care claims or quality improvement. What's left over, either $20 or the $15, goes to administration costs or profit. So if they exceed that profit margin, they have to pay back to the consumer. So bottom line is the operating margin on insurance companies supplying insurance through ACA is about 35%. Not extraordinary, but we'll see in a minute how that can add up to significant profits when everything is added up. So some insurance companies have bought companies that provide the healthcare services called vertical integration. For example, the insurer normally would pay the hospital and the doctor or the pharmacy. If they own the provider, then the insurer pays the company it owns. So the revenue stays within the corporate group. The services, such as doctor's visits and pharmaceuticals, are normally higher profit margin than the insurance profit margin. So it helps offset some of the insurance cost. An example would be United Healthcare owns Optum, and they would therefore pay Optum for the pharmacy services, physician and clinic services, care management, and so on. And this stays within the United Healthcare overall company group. What surprises me about this arrangement is the prices on medical services are not regulated on ACA plans the same as they are for Medicare and Medicaid. The pricing is negotiated between the insurance company and the provider. And this really surprised me about this arrangement. So what you get is the results are the pricing for people on the ACA plans are can be as high as 150 to 250% of Medicare and Medicaid rates. So this is a pretty interesting situation we have between the insurance companies and the providers, which are owned by the same company. Here you have a table showing the estimated operating margins for a major integrated insurance and healthcare provider. Breaks it down into the private funded type services versus the government funded. And you can see here the revenue stream. Private makes up about 50-55%. Government funded is about 45 to 50%. And you can see the different corresponding margins, 9 to 12% on the private funded and 4 to 6 on the government funded type business that this particular company does. This is not too, this is about the middle of the road when you compare it to the corporate world of S&P companies. These companies are making a lot of net revenue because of simply the revenue, the amount of revenue that they're dealing with, but it's about the middle of the road when you compare it to other industries as far as the operating margins. So here you have a cost comparison with American healthcare costs per capita versus other developed countries. And you can see here in the United States, we're close to $15,000 per year per person. Healthcare costs versus the average in other developed countries is around $7,300 or so. And to me, this is a real outlier. And you can, you go to Switzerland and you're paying, you compare Switzerland to the United States, you're paying 1.5 times more in the United States as the care in Switzerland. And I guarantee you, Switzerland's got good medical care. So by this metric, there's something going on. We got a fox in the hen house somewhere where it could be just, Americans' lifestyles, generally are not as healthy as some of these other developed countries. And that's a contributing factor to the healthcare cost. So let's talk about the differences between the current system we have in the United States versus a single payer system. This is often argued by some politicians and some of the public that the United States should go to this type of system. Overall, the United States spent $4.9 trillion on medical care in 2023, I think that is. That included private medical care, cash pays, and government-funded medical care. So anyway, the argument in some camps is that we should go to a single-payer system which has more efficient payment methods, lower administrative cost, and everybody has coverage versus in our current system, you have some people who are uninsured or underinsured. Big argument on the single-payer side is if people have access to preventative care, they have less major medical costs. So that ultimately is a benefit. Some of the big disadvantages on the single-payer system is the speed of care. In many cases, for general surgery, you may be waiting longer. For general type care, if it's an emergency surgery, as I understand in some of the government-run systems, they get you in and get you taken care of. But overall, it's hard to argue that the quality that we have in the United States system is probably the best quality of all of the world. Because of the innovation, the incentives we have to basically make money in the system, which is kind of good and bad in ways when costs can get out of control. But this is a highly sensitive, politically risky topic among much of the voting public. As I mentioned, some public and politicians think we should go to a single-payer system and get everybody covered. But that's, again, the argument between the two groups, and we'll see how that ends up over time. But right now, it's still the political divide between the United States public. Well, we've reached the end. That's all for now. And thank you for listening, if you're still awake. I know this isn't too terribly exciting stuff, but this was a layman's attempt to try to just go over some of the data with the medical care system. And, my platform for running for Congress is to try to balance the budget or be an advocate to balance the budget. Medical care takes up about 25% of the budget, so obviously this is a big contributor, and there's some fixes to be made. I don't have all the answers here, but I can tell you I'm willing to listen to all different sides of the arguments here. Everybody from the people in need and the providers and the people who are paying, which is the common taxpayer. And I think that's key to coming to some reconciliation on the healthcare argument. As I mentioned, I'll be posting this on social media, and I would appreciate if you listened in to any comments, you have criticisms, corrections, and all. So with that, appreciate your support and have a great day.